Hello, everyone, and welcome to today's symposium. I'm very honored to have you all here from across the globe. We have our TUFH president on the line. Nick, do you want to say a quick hello?
Just welcome. Welcome, everyone. And thank you to Siobhan Fitzpatrick from WHO for being here with us. Thank you.
Great. And with that, I'm going to hand it over to Siobhan Fitzpatrick, who will take it away.
Super, thank you everyone. So brilliant to see so many people have joined us today, which means, I hope this means that you are interested in the public health workforce and WHO's latest competency framework for strengthening the essential public health functions. So I hope that most of you have had a chance to have a look at the framework in advance, but for those of you who haven't, I just wanted to run us through some of the context, the background to the overall roadmap, and then we can look at some of the different elements of the competency framework so that when we go to the discussion groups, we can really be reflecting on the implications of that framework for our own practice and education and curricula. So the works was launched in 2022. WHO, together with around 70 organizations, collaborated to launch a roadmap for strengthening the public health and emergency workforce. And this was very much coming out of COVID and capitalizing on the partnership opportunity. So with the spotlight on public health at that point, particularly focused on communicable diseases, but how do we keep that focus that public health is much broader than communicable diseases, but the whole of public health, prevention, health promotion, and by bringing the partners together, rather than everybody developing their own sort of efforts in epidemiology, perhaps we only need one, and then as a partnership, we can highlight other areas to strengthen. So that was really the background. So it was to develop that shared understanding of public health and to develop the tools to guide the strengthening of the workforce. So the roadmap is very much focused on a whole of workforce approach. So first, by understanding what public health is, using the 12 essential public health functions as a lens to identify the programs and services that are relevant for context. But then for the workforce perspective, we need to both quantify and know who is in the workforce, what they're doing, and how many of them there are, in order to understand how many we need. And then we look at how best do we train. And that's where this framework comes in. When we're talking about the public health and emergency workforce, we're thinking that holistic workforce. So more than just core public health specialty occupations, but also looking at public health within the role of health and care workers, and also occupations allied to health, so agriculture, border control, and others. So the tools were published earlier this year. There are 4 tools in the package. The first is a guidebook. This is very much geared at country level ministers to highlight the importance of the investment in strengthening the workforce, the return on investment, and also then guiding through the other 3 tools as a whole workforce strengthening approach. The first of the technical tools, so technical tool number 2, is about the essential public health functions. And you can see that there are 12 EPHFs. There are different regional variations of this, but these 12 are at the global set. So we looked at the different EPHFs across the different regions and found the commonalities. So there are 4 service-oriented EPHFs, so health promotion, disease prevention, detection, health protection, and emergency management. And then there are also the 8 enabling EPHFs. And these are very much at a systems level, stewardship, health services, quality and equity. So access to health services is still considered a public health function. So the tool then guides an approach to identifying within those 12 EPHFs, what are the priority risk factors, health priorities, and therefore what are the needed services and programs. That is at a workforce level. So the 12 EPHFs are, as a whole, we need to ensure public health emergency management, for example. And then as we go into more detail, we can quantify what are the contributions of individuals to those EPHFs at the task level. And that is particularly where we're interested then in designing and strengthening competency-based curricula. So the next tool, and the one which I will talk most about today, is a competency and outcomes framework. But it is more than just the list of competencies, it is guidance for that whole of program approach on how to integrate public health into curricula. So very much focused on the outcomes for education aligned with the programs and services to deliver the EPHFs. Just quickly, the last tool, and then we'll talk in detail about the framework. So the last tool is guidance to map and measure the workforce. And as I mentioned, this is very much about quantifying who we have, what they do, and then what the gaps are so that we can really estimate what the workforce needs are. And there's a 13-step methodology in that tool as well. So competency-based education, I know there have been a number of TUFH webinars on this and lots of different approaches. For clarity, I will just describe briefly how WHO conceptualizes competency-based education. So we think of competence as the ability to do something. So are you ready for practice? This encompasses both the activities of health practice, encompassing tasks, so the what somebody does, but it also requires the competencies of the individual to do those tasks of health practice. So it's a holistic approach to competence. From a curricular design perspective, we need to go beyond that and understand the component knowledge, skills, and attitudes that underpin the competencies and the practice activities. Within the WHO framework, we identified 40 practice activities for the workforce as a whole. So this is a high-level framework that guides from those 12 EPHFs the different areas of work that an individual can contribute to the delivery of the essential public health functions. So you can see that these are organized into at the systems level, perhaps looking at governments or community engagement, social participation in decision-making, public health intelligence, the data, evidence, and the intelligence that informs decisions, that informs programs and service design, as well as the delivery of programs and services, the resource management to do so, and of course, the emergency management spectrum. And within the framework, additional guidance is provided to inform curricula, looking at the detailed knowledge and task lists that individuals might be expected to have responsibility for. The framework also identifies the competencies for public health. And this was a really interesting part of our research, is that we identified that the competencies unite the public health workforce, whether you're a health and care professional for whom public health is a part of the role, the occupations allied to health, as well as core public health practitioners. We identified that these 20 competencies are essential for all public health practice. And this includes community focus, effective decision-making, effective communication, collaboration, of course, with individuals, with communities, with other sectors, as well as evidence and personal conduct. And there is also guidance in the framework around how to integrate those competencies into curricula and strengthen programs. So just my last slide here. Oh, I can see that it's a little bit difficult to read depending on the screen that you're using, but just to bring that back into that overall roadmap focus on the workforce approach, that WHO and partners have set an ambitious agenda to see public health curricula strengthened across all countries over the next 5 years. So we're very much looking to you to bring your ideas as to how we can do that. We have identified that one of the key partners to work with is regulation and accreditation, and how can we ensure the inclusion of public health there. So starting with the standards and almost a benchmarking in terms of where are we and where do we want to go. And then you can see the guidance then takes you through how do we improve on that and how do we deliver competency-based curricula for public health. Thank you. A whirlwind tour there, but I hope that was helpful just to situate the conversations we'll have today.
Thank you very much, Yvonne. Very interesting and a very good layout. I'm opening the floor to some concrete questions that the audience might have to Siobhan after what she's explained. We're gonna be going into discussion rooms to go over the discussion questions, but I'm giving an opportunity for concrete questions about the content that was just presented. Any questions for our presenter?
I can see one in the chat. Is
Go
there
ahead.
training for this? So no, there isn't a training that takes you through the content of the roadmap and the tools. The tools themselves include checklists and step-by-step. So there is guidance within each of the published tools. And our intention is then to inform the design of training using those tools.
Great. Any other questions? You can speak up. Yeah, Nick.
Just Siobhan, is there an example of how an institution might use this competency-based framework and apply it to maybe a course that they were using in terms of just maybe an example of how that has realized itself?
Thanks, Nick. Great question. So when we provide that tool, the list of 40 practice activities for the workforce as a whole. So the first step is to identify what are the relevant parts of that framework for your course, for your occupational group. And that might be a subset of the practice activities, or if it's a short course with a specific focus, that might be one area like emergency management, for example. So the first step is to identify what are the role responsibilities, and then you can look at the specific practice activities to identify sort of the knowledge guides, the relevant competencies to inform those programs. The other important part of this is the guidance for competency-based education generally. So the principles, and actually a lot of public health, we find like many traditional MPH programs are quite academic in their focus. So how can we better align courses and programs with readiness for practice? What does that overall pathway look like? And some of that goes beyond what an individual program or institution can do, but collectively, what are the challenges and how can we help to address those challenges?
Thank you.
Thank you, Siobhan. There's a few more questions in the chat. Can you have a look at those?
Yeah, absolutely. So I'll take the question first about discussion with policymakers. Absolutely, WHO is a member state organization. So the request for these tools and guidance has come from member states. So I think we are absolutely in discussion at that level already. There are also opportunities with different countries who are, for example, in receipt of the pandemic funds allocations, so who are already actively taking approaches to strengthen their public health delivery. And how can we ensure that that conversation and that approach also focuses on strengthening the workforce who will ultimately deliver the public health services and programs? The other two questions in terms of how can this be used, so for youth as well, you can use this as a basis for advocacy. So who is responsible for public health, for curricular design? Is that, are those programs provided in the most effective way? So this gives you that reference for WHO places the emphasis and the importance on this area. And then I think the last question about structured capacity building, very similar to the first one, in terms of the tools are there, they're publicly available to provide that insight. But no, there isn't a course on the roadmap, for example, but that's why there is an opportunity today, for example, that we can have these discussions now.
Great. I'm gonna now move over to the discussion rooms. So in a few minutes, I'm gonna be assigning everybody into small breakout rooms. You'll be around 6 people in there. I'm gonna put in the chat the 2 questions that we really want you to answer within your group. And the goal would be that you focus on this discussion points in your group. You assign someone to take notes, and that at the end of the 10 minutes, because you will be coming back to the main room after 10 minutes, your group has some pointers of input on the questions that are being asked. So what is it that you're going to be discussing in the smaller groups? Which of the practice activities for the delivery of the EPHFs are most relevant? And to what extent is public health already included within health professions education curricula? To what extent do students and faculty consider themselves to be part of the public health workforce? I do recommend that you turn on your webcam and your microphone for easy discussion. Should there be any concerns, you can always let me know in the main room. That being said, I'm going to move you in for your discussions 10 minutes, and I will repeat the discussion questions. Here you go.
Because I didn't have an effective discussion. And we had also a technical problem that one lady, she was discussing and then she was pulled out. For me, I am a specialist in quality and accreditation and education. And I tell you, any program that has no implementation and no proper preparation for all to be aware and able to implement it is a failure from the start. Sorry to tell you, but this is it.
Okay, thank you, Miriam. Do we have anyone else from her group or other groups that have input on the questions? What are the activities most relevant and how it currently relates to the curriculum in health professions education? Anthony?
Yes, we discussed through our own personal lenses. I think one of some of the things that were brought up in our group, I think the importance of a collaboration and really looking at a wider view of who our healthcare partners are and who are other stakeholders that can enable a collaborative approach to meeting these needs. And the other thing is we also mentioned that there's probably not enough emphasis on public health, these essential functions and traditional educational models for the health professions like medicine and those types of things.
Okay, thank you. Ram Prakash?
Yeah, thank you. Good day, guys. I'm the professional health practitioner at Dwagel, attached with the university for the teaching program for undergraduate and postgraduate family physicians. We recently have some experience about the curriculum development and moving from traditional curriculum to the practice-based assessment. And most of the experience, what we learned from the COVID pandemic also, when COVID pandemic came, that we realized that no, what we teaching is not aligned what the community's need is there. So that mismatch, we're trying to fill the gap by moving the traditional curriculum to the adopting the more community-centered or community-oriented or patient or person-centered approach. We called it the practice-based assessment or competency-based untrusted professional activity. The challenge what currently we facing in South Africa, that yes, that we develop the EPA like small activities for the assessment, but the soft skill is more challenging to assessment, like a behavioral context to context, different contexts have the different behavior. So uniformity, that curriculum to apply across the context is going to be might some challenge there. We also have discussed in the group from one of the Morocco also the experience they share in the group. Same like she's the undergraduate student, but she's saying she's a new for, but still adopting the and looking forward for this new tool, how to apply in their own context.
Okay.
Yeah. So,
Menatella Elmala?
Hi. So in my group, we shared like our perspectives, and we all like agreed that some of the topics, such as maybe health equity, disaster preparedness, and some of the topics are not like we lack this kind of topics in our curriculum, and that's why sometimes like we are concerned about if we're prepared or not, and like it all depends on how each student or like each individual tries to gain their experience or knowledge from other activities or like through extracurricular activities, which is, you know, these are supposed to be part of our curriculum, and we couldn't like find, even if some topics are delivered, it's just the very basic that still doesn't prepare us when we graduate to be part of like public health programs and try to advance our national public health. And some of the activities that we share that we might be involved in, or like we try to be involved in through mainly through IFMSA, was maybe like trying to collaborate with other stakeholders and advocating in public health and developing and the delivery of public health campaigns. And also we kind of try to be involved in policy making through IFMSA to present our stance like as medical students worldwide. And yeah, this is like the brief about what we discussed in our group.
Thank you. Siva, Santosh?
Yeah, hello all. We could not get that much time to discuss both the questions in full extent. So the amount of discussion which happened in my group is most of the people in my group are working in medical schools or public health schools, including me. The thing is that like in medical schools and public health schools, the students are more interested or more concentrated over clinical subjects like medicine, general surgery, pediatrics, etc., etc. in their education compared to public health. So that is the main problem all over world. That's what I understood from today's discussion. I thought it is only for India, but it seems like the same condition in Brazil as well as other countries also. So that is one thing. And when that is the thing, like what can be the more relevant option is to make some more productive activities, like maybe involving them in these activities in the field itself. That thing, like I have discussed, I mean, I have seen it myself in my own experience also. Like whenever like we take the classes of these public health related topics, students are not at all interested. Maybe 10% of the students will listen to those sessions. But whereas if we take those students only who are not interested, the remaining 90% into the field, and we show them like these are the things, and we give them some activities to make them use their conscience, use their common sense, use their knowledge and all. They themselves told like they are much interested in public health because of the field level exposure rather than the classroom exposure.
Okay.
So yeah, this
Thank
is
you
what
very much.
yeah we are able to discuss. Thank you. Thank you.
Great. And then the last person before heading to the next part is Basel Allah.
Yes, thank you so much. In our group, we discussed basically mostly the practice activity domain 3, which is public health programs and services. We were talking about how planning public health programs and services would be crucial for identifying helping others identify the relevant aspects for their own regions, for their own schools, because we were talking mostly about a teaching-based approach, we're talking about how we can teach others. And so we thought of developing and delivering public health campaigns. We thought of continuous quality improvement of programs and services. So these were the main practice activities that we were discussing. As for the other question, whether we think we have HPE in our curricula, we feel like to some extent we do. Like we kind of learn about some essential health, public health aspects. However, we do not feel we do not consider ourselves a part of the public health workforce. We're still not there yet. We just learn a little bit about each thing. So yeah, that's it.
Okay, thank you very much. Okay, very interesting comments after that first question. And we realize it's a lot of information that you have been given and a brief amount of time to discuss it with people that you do not know, but the richness is there. I particularly like the fact that we can see cross-country similarities. And I think a lot of the points that were mentioned will also lead us into the next discussion question. I've just posted it in the chat. So what I really want you to focus on now, and you again will have 10 minutes, it is what are the opportunities to strengthen education for the essential public health functions within curricula and how? how can the WHO framework be most useful, who needs to be involved, and how are they best reached through our networks. So I think there's already been some mention of points about, for example, taking them out into community and showing it, doing campaigns about it. So there's already been some touch on it. So really now the question is for input to the World Health Organization, because they are also here. Siobhan is here to want to listen to you, to hear from you, your ideas. So we really want to think outside of the box, think within your cultural context. How can this best be used and how can we implement it? So I'm going to put you back for 10 minutes into your breakout rooms. So if you see it pop up, and then after 10 minutes, we'll come back. Same scenario, have one person in the group be able to provide some pointers. Thank you, everyone, and see you in 10 minutes. Okay, welcome back, everyone. I hope you had a useful 10-minute discussion. So the goal now is really to look to what the opportunities are to strengthen the essential public health functions within curricula. How can we do it? How can the framework be most useful? And who needs to be involved? How do we reach them? So I'm again looking for volunteers from their groups. Can be the same people, can be other people. Kavitri?
Yeah, we just discussed that last minute, like how we can reach the people depending on the community and the culture. I think it would be safe to approach cultural leaders, religious leaders, and train them also so that they can reach out to the population where they are in, the community they are in. And especially given that the community will have more trust in those people. So that is one way. And other things that we discussed was that the education and awareness of our youngsters, which should be put like on a priority because in many countries, apart from healthcare professionals, the other parts of a community and the population at large are unaware of the public health measures put in place. So if they could be educated on that front, through the media, especially using the technology, given that the youngsters are more used to the technology, they have access to internet and mobile phones, so they will be able to access it and research on it.
Okay, thank you very much. Omar?
Yeah, hi. I'm just about the public health. I think the word public health should include whether you are in the hospital, whether you are in the health center, whether you are in the supermarket, whether you are in the park, or whether you are at home or you're visiting someone else. As a clinician or as a lawyer who's part of the public health and everything like that, you should help people to increase the awareness of these people. This is one aspect. The other aspect is that the word clinical, we assume that clinical means that it has to be in the hospital, all right? And the best example, when we, even in, again, those who know me, my examples are football related. So when, when there's a nice goal, what they would say, the commentator, they would say a clinical finishing, okay? So that means in a way that you need to be really very competent in order to reach that and score a goal. So I think we need to, we assume so many things with all respect to WHO and everything like that, but we forget that the society is very important, okay? And all of these guidelines and everything, I've noticed that many of them are not mentioned in the guidelines about the society and the feedback and their importance. What is the benefit of being a competent doctor, but the society cannot visualize this person as a good clinician? Thank you.
Thank you. Rebecca?
Yes. Hi, everyone. I think in our group, there was appreciation for just taking a step back and looking at the full, multiple components of this roadmap and what they have to offer, and seeking out the data and seeking out something that can be applied globally because of its flexibility. But I did get the sense that there's still sort of like a fundamental concern, or maybe just remaining question about even what the support will look like to interpret and translate and implement the tool. So even though we were able to identify partners, and I think what we talked about were, the WHO country offices maybe providing support and guidance, and then of course getting accreditation boards to the table, academic institutions and the faculty to be aware of the tool, and others who design and implement curriculum, and then student advocacy. We can identify that, but I think understanding what those roles will look like and how it will actually be taken from the page out into practice is just causing people a little bit of, concern and confusion. And then the other question that I did want to mention, because I thought it was interesting before I get off the line here, was that within the flexibility of the tool, because it's obviously meant to be extremely malleable, extremely flexible, but there's a question about whether that flexibility exists also in terms of assumption about capacity and resources. So is this flexible enough to be taken out and put into action in a really truly global way? Or does it rely maybe too heavily on, resource-rich regions, populations, et cetera? So I just putting that out there for consideration.
Thank you. Very good points. I'll have Siobhan do a final concluding remark. We have two more speakers, and we are conscious of the time coming to the end. So I'm going to ask Siva and then Basil to be very concrete and quick in their input.
Yeah, thank you so much. So again, we had a good discussion. So the thing mainly I'll focus on who has to be involved. So during the discussion, we understood that everyone has to be involved, starting from the political commitment onwards till the student level, administration, faculty, students, and definitely the political commitment. So all these things to be involved to make this successful. That is one thing. And then second thing, as already we have discussed, community-based education is must for public health. To make the students learn the essential public health functions, and that has to be involved in the curricula. And yeah, and one more thing is how can a WHO framework to be most useful? That is to increase the awareness. Actually speaking, till today, I don't know that there is a framework. Okay. After this symposium only, I too came to know that there is a framework. So yeah, so awareness is much needed. Thank you.
Okay. Thank you. Basil, really quick.
All right. Thank you. So, regards to strengthening education, we were discussing more how we can integrate a concrete approach or like an experimental approach rather than just abstract learning and theoretical knowledge. We feel like having the concrete approach would be better for students to contextualize the framework into their own needs. And then we also discussed how the framework should be integrated into national policies with national accreditation bodies, so that it should be basically not enforced, but just allowing universities more spaces to integrate their the framework into their needs or their regional and local needs. And then we discussed that we should involve students across the globe because they have the capacity to push for change, as well as becoming the upcoming leaders and educators themselves. And yeah, so that's quickly what we discussed.
Great. I'm going to have to conclude as we are at the end of time. Karen and Dua, if you want to put some final remarks or questions in the chat, please feel free to do so. But we are coming up to the end of the discussion. From TUFH's point of view, I want to share that we will be sharing the recordings of today's session. We'll also be sharing the slides that Siobhan had prepared in PDF format. This could be useful for you if you want to now take the knowledge you've learned here to take it out, as Siva mentioned, saying, I've only now just become aware. So you are all now the core people who are aware. So it's now up to you to start spreading it out. And little by little, we will reach the entire globe. I will also in the follow-up email reshare the direct links to the tools that are, again, open to everyone, to the public so that you can take it from there. And then I'm going to hand it over to Siobhan for some concluding remarks.
Super, thank you. And thank you, everyone. This has been a really rich and insightful discussion. So just great to be able to hear that and take part in that today. I think some of the key messages that I'm taking back to the team are dissemination is key, but it's not enough. Actually, from that first discussion, hearing as to the challenges of identifying the content of curricula as public health, or seeing individual occupational groups as part of that public health workforce. So part of it is getting the tools out there, but the other half is appealing to, and this is relevant for you because. So CV, you were talking about the evidence, and absolutely, this is all, we're very early in this process, and it will take time both to disseminate, but also curricular review takes time. So we know that this is an incremental process, and it's great that we now have everybody on this call as well, potentially interested in partnering with us. Absolutely, the level of support will vary according to what the ask is. So the first port of call is to ask in your WHO country office, and then we can go from there. But WHO is working with more than 70 partner organizations. So there is a good chance that between the partners that there is somebody working in the different countries as well that can assist and provide guidance. So a huge thank you to all of you for taking the time to learn about this today. Thank you.
Thank you all very much. Siobhan, I'm going to ask you to pay attention to the final remarks from people, but everybody else, thank you very much. Have a lovely day, and we'll see you at the future events. Have a great day. Bye.